I think there's an awful lot in Alan's presentation to respond to. I'll probably start at the end, which is about, his point about cultural change. And I think, I now work in the voluntary sector, though I spent most of my career in local government. And I think our culture about, why we do things in this country is fundamentally different from, that in place in other countries, particularly those that do better. I remember when we had a visiting party of Danes when I worked in the council, and we were doing a presentation about our services and the various bits of legislation that governed it, which seemed to kind of confuse and bewilder them. And eventually one of them put up their hand and said, "Why do you need laws to make you do things?" And I thought this was quite an interesting divergence in how they did things because they thought they were a good thing to do. And the idea that public bodies did things because there was a law that compelled you to do them was something that they thought was just a very strange culture of service provision. Having said that, I think that it's very clear that I agree with Alan that the moment is ripe for doing something. I think I'm personally very pleased that early years and parenting are moving up the agenda. I think we are not doing enough, and we're probably not doing necessarily the right things. I think that if you look at some of the OECD figures, we are actually spending as much on young children as some of the Nordic countries are that have, a much more comprehensive system of child health, well-being, early childhood education and care, with much better and more equitable outcomes, not just for children, but across the whole of their society. So I think that we need to think about the value for money we're getting for the public pound in the services that we are providing. And I do think that some of the things that we consider good enough evidence of intervention, we really need to examine quite closely. I've seen some, evidence-based programmes that have been invested in very heavily, not just in this country but elsewhere, where the outcomes seem to be, if you read some of the evaluations, a bit better than awful. As a parent, kind of avoidance of prison wasn't the summit of my aspirations for my children, and I don't really see why it should be for anyone else either. I think Professor Heckman's graph we've all seen many times, and yet we continue to spend more on children and indeed on the population the older they get. We spend far more in secondary school children per head than we do in children in early years, and if we are going to address this, then I think that's got to change. I agree with Alan absolutely about monitoring and keeping good data. And I think there's a world of difference between, Holland, where there's something like about, I don't know, I didn't count them up, but, about a dozen routine contacts, whereas now one of my colleagues, her older child has just gone to school, and I think after 6 weeks she had no contact with the health visitor whatsoever, because at 6 weeks it was reckoned they were doing fine. I know there's proposals to reintroduce one of the checks, but we're actually further behind than we were 20 years ago. When I had my children, and my older one will be 21 on Saturday, they had 3 routine checks, so that at 8 months, if issues were emerging, either in terms of the child's health or development, they could be addressed then. And that's actually not the case now. There are children turn up in nursery who have poor language, poor communication, and indeed physical problems and disabilities that no one's picked up on. So I think if we're aspiring to get it right for every child, we really need to address these. And I think the other thing I'd absolutely agree with Alan is that the focus on children, I think, needs, while it is absolutely right and clearly nobody wants to risk any serious harm or problems occurring to children, and we've had too many appalling child protection disasters for anyone to feel comfortable with that. But that shouldn't rule our whole method of intervention and our whole approach. We need to think about children in their family context, and very often an adult's well-being is the first pointer to perhaps a risk or an issue in relation to children. I was just seeing figures from one local authority where they had looked at the rent arrears figures and found that was the best predictor they had of difficulties in families that was resulting in problems for children than any measure they could take of the children. So I think we've got to look at some of these things.
Can I interrupt you there, Marion?
Sorry?
Can I stop you there?
Can I just say one more thing? I think we've actually got to have a vision about where we're going, and I think that's something we're not very good at. We're good at saying what's wrong. We're not very good at articulating what should be in its place. And I'm quite concerned at the level of fragmentation we have about early years in Scotland, where there's no kind of coherent kind of route map and clear destination that we're all aiming for.
Okay, thank you very much. That's great. Rachael, please.
Thanks very much. Thank you, Alan, for a really enlivening talk, and I'll do my best to respond. There is, as Marion said, a lot to respond to in it. I'm a public health doctor, and I agree with a lot of what you said, and a lot of it chimes with me very much. I think that the notion of a life course view and the early years being very much the root of not just health outcomes, but wider social outcomes, skills from your point of view, relationships, economic outcomes, is well recognised and very useful. I agree that it is well recognised now within certain communities, so certainly within the public health community, increasingly within policy-making communities. The rhetoric is there, and the aspiration to really make meaningful change around the early years is certainly there. But equally, I would agree with your analysis that actually the action is patchy. And actually, although some of our children do well, and we do tend to overly problematize things, and in some ways I want to stress that most parents do a good job, health visitors work hard, teachers work hard. So you don't want to add to burdens of guilt and people feeling put down, but yet actually we tolerate really poor outcomes as a society for our children when you look internationally, and I think having an international focus is really helpful because it lets us put ourselves, understand ourselves in a wider context and set our aspirations more clearly. And we have normalised now, we accept, willingly or more likely very unwillingly, we tolerate incredible levels of inequity in our children's outcomes. Unhealthy, inactive transport, unhealthy weight are completely normalised within our society. And some of us are working hard to try and address that, but sometimes it is difficult not to feel overwhelmed by the scale of the challenge, frankly, and to know where to best to start to change these cycles. I agree very much with that. I mean, our social mobility in the UK generally is unbelievably low, and intergenerational perpetuation of that is also a very significant challenge that we face. I think it's good to look at the current financial climate as an opportunity for change, because otherwise you just really would pull the downy over your head and not get up. So we need to try and find some point of action for change in all of this. I agree as well. I think it's really important to emphasize and remind ourselves that although you can feel overwhelmed by the scale of the challenge, that you can do things. These outcomes are not inevitable. And very specifically, policy matters. It matters. The choices, the priorities that we set in times of austerity, the policies that we adopt matter, and they can make a very significant difference to our children's outcomes. I think your notion of focus within policy making is interesting. I think it's quite difficult to operationalize that, because you want to think big and articulate a big vision. But you're right, ultimately policies have to be quite specific. And what is the right thing to prioritise? I would be certainly very happy to see more health visitors. I recently published a formal international comparison of child health programmes, health visiting programmes for young children, and there's no doubt that the Scottish programme, even with its recent extension, is still relatively slight compared to other comparable countries. So I certainly would like to see an extension in that. But I'm not sure if it would be my number one priority. If I could fix that or fix having really high quality pedagogue-led early childcare, I'm not sure which I would choose actually. And those kind of trade-offs are very difficult to make. And the last thing I would say, I suppose, reflecting specifically as a public health doctor, what are my responsibilities in all this as a public health professional? And I jotted down 3 things. I suppose I have a responsibility to try and monitor, we collectively have a responsibility to monitor the health of our children and our children's outcomes, and that's particularly relevant to me in my job at ISD. I think we have a collective responsibility to try and understand and explain if trajectories are poor, and also to understand and explain what might best change those trajectories for the better. And then lastly, to engage to try and do something about it, and whether that's, and that certainly isn't something public health can do by itself, but engaging with policy-making colleagues, with service providers, with the public, to really stimulate change.
Great, thank you very much. That's excellent, thank you. And Dona?
It's always great going third, maybe. A couple of things I'd like to pick up on. So first of all, I'd quite like to respond to the notion of culture and tensions, because I think that's the game that we're in at the moment. We have made a case for early years, in my opinion. I think we're all trundling along and going round in circles and trying to find out what it is that will make the biggest difference for the resource we have. I think there's potential that we could miss a trick if we don't continue to focus on early intervention throughout the life stages. And I guess as a member of the adolescent group, I'm going to make a wee bit of a plea for continued effort around adolescence. So I'm not going to talk about early years. I think we've spent many years, last 20 years probably, focusing on targeting our work. We have looked at those most in need. We have identified thresholds that have been particularly high before we intervene in the lives of children and young people. And I'd like us to lower those thresholds, and I'd like us to bring back greater effort within universal services. I'm not convinced we've made enough of the arguments made by Michael Marmot around proportionate universalism, yet we've got many studies that tell us that some of the work we do around early intervention is stigmatising with young people and families, and if we can get a culture of prevention and early intervention within our universal services, which are in the most part of a good standard, then we can support children and young people throughout their lives when they need it, and that will change. It won't just be under 5s, it will be as they move through. So I guess I would like to make a plea for bringing together the good work we do within education, within youth work, within health, to take a more coordinated approach to young people, and to see if we can truly change the culture, so that when I phone a social worker and say, I have a 14-year-old having sex and I'm not very comfortable with that, she doesn't respond to me by saying, I'm sorry, but I have an under 5 who's higher up the list. That's not what we should be responding to in terms of our service provision. So I like the notion of getting it right for every child. I think we should consider that on a daily basis. People I speak to every day tell me that they love to get up in the morning and think about the difference they're going to make to children's lives. And that's the kind of workforce that we need. I think Rachael's touched upon a few points about the quality of our services, and I do think that's one of the things that we should be focusing on. And personally, I would be a little bit harder. And I would say, if you're not in it for the kids, then don't be in it at all. We've said this to many youth workers that I work with. If you're having a bad day, don't turn up to run the youth club, because kids don't deserve your bad day. They deserve your best work. So I would encourage us to think more about the effort we put into our workforce in order to help them do the job that they need to do. But my plea is not to just focus on early years, but to focus on early intervention and to put our efforts into our universal services. I have lots more to say on teenage pregnancy, but that can come up later.
Brilliant.
Thank you
very much indeed. Alan, if I could give you 1 minute to come back on any one point that came up in those 3 responses, would you be able to find one?
Sorry, the challenge, I think, is this one of having a picture, the big picture that makes sense, and it's coherent, and it's not necessarily excluding the adolescent, because so many of the issues that they deal with are reflections of what's happened earlier, but also them becoming parents, and having the cycle going on. So we have to kind of get ourselves reframing that properly. But as I look at what seems to me to work or make the most difference, and if I'm thinking of the rates of return and I'm looking at Holland, they have very little about childcare in Holland, but what they seem to get really right is this bit about supporting parents from pregnancy up to about 3 years of age. And it's interesting how, when I see that in Holland, and they don't have evidence in Holland to say that's what it does, that's just what we do. Jim Heckman, in the country that's one of the worst at early years, has produced all this other evidence, which shows that that's what, if you're using public money, that's the place where you'll get the biggest return.
Okay, thank you. I'm going to leave it at that, I'm afraid, just because the time is pressing on.